Welcome everyone to our official announcement and kickoff of Train the Trainer program for reproductive healthcare justice for Latinas. I am Dr. Lauren Cyrek Enriquez, a board member of the Latina Civic Foundation. Today, the Latina Civic Foundation is formally announcing a partnership with the Latino Action Network Foundation to address the disproportionate rates of maternal mortality and morbidity, and to promote reproductive rights and the right to bodily autonomy among Latinas. This partnership was largely made possible thanks to a generous grant from Planned Parenthood Action Fund of New Jersey. The Latina Civic Foundation is a 501c3 nonpartisan educational committee whose mission is to build a network of civic engagement that expands Latina women's capacity to develop their leadership potential and impact policy change via civic engagement in their local communities. By training women with the skills needed to run for office, manage and run electoral and issue-based campaigns, and build a base of strong community leadership, we hope to lay the foundation for future change makers. The foundation also supports initiatives that inform the public on critical issues that matter to Latinas in New Jersey, such as this one, reproductive health care. And for today's virtual event, we have with us experts in healthcare and public policy that will provide Latinas with the resources to understand policy implications, combat the stigma surrounding abortion, and advocate for access to affordable reproductive health care. At this time, I would like to ask Saraí Ramos from the Latino Action Network Foundation to talk a little bit more about the partnership and about LAN.
Thank you so much, Lauren, and good afternoon, everybody, or good evening. My name is Saraí Ramos. I am the Health Justice Coordinator for the Latino Action Network Foundation. We are also a charitable organization that was founded in 2010 with the ultimate goal of uniting the Latinx community across the state of New Jersey. And our work primarily revolves around advocacy, research, policy, and outreach for all Latinx and immigrant communities across the state. We have several program areas with the primary focus on workforce development, specifically through our Hispanic Women's Resource Centers. But we also engage in policy outreach programs such as clean energy, job recruitment, housing access, criminal justice, health justice, and educational equity, just to name a few. But we are proud and honored today to join hands with Latina Civic Foundation to launch such an important program to continue our efforts to reduce stigma around reproductive health. And we hope that this project will engage more Latina women and Latinx individuals throughout the state of New Jersey in discussions around reproductive justice, bodily autonomy, and a fair and inclusive sex education for Latinx youth and parents.
Thank you, Saraí. I would like now to introduce our moderator, Dr. Franca Roibal Fernández, to lead the discussion with our wonderful panel.
Hi, everyone. Welcome. I'm so excited to be here. I am the founder of Soliduna Consulting. It is a diversity, equity, and inclusion consulting firm. And I'm so happy to introduce our panel today. I'm going to ask both of you to talk briefly about your roles and your connection to this important topic before we get into this exciting conversation. Alejandra Sorto is with ACLU New Jersey, and if you could just briefly introduce yourself, your role at ACLU, and your connection with the issue of reproductive justice for Latinas.
Sure. And let me start just by saying I'm so excited and grateful to be here with you all today talking about such an important topic, especially for our communities. So I'm Alejandra. I use she, her, ella pronouns. I'm a campaign strategist with the ACLU. The ACLU is a nonpartisan nonprofit organization that works across the country to advance racial and social justice through legal and policy work. Within my role, I work in the areas of reproductive rights, democracy, and immigrant rights. And we work to advance policies here in New Jersey that also support our communities and that are implemented in the best way possible to advance our values and our principles of racial justice. So that's a little bit about my work, and I have led our work in enacting legislation here to protect the right to reproductive autonomy in New Jersey, and looking to expand further and make New Jersey a leader in reproductive rights and access.
Excellent. Thank you so much. Welcome. I'm so excited to chat more and learn more, and thank you for being here. And then we have Tatiana Castrillon. She's with Planned Parenthood Action Fund of New Jersey. So if you could also tell us a little bit more about that.
Hi, buenas noches. So excited to be here tonight. My name is Tatiana Castrillon. My pronouns are she, hers, ella, and I'm the field director for Planned Parenthood Action Fund of New Jersey, which means I work with volunteers across the state to help promote our agency's policies and to help connect volunteers to resources across the state to work to expand reproductive rights. My role is really to be a liaison with the community, to work with different partners, and to help bridge the gaps to healthcare access here in the state. And I'm just really excited to have this conversation tonight. Thank you.
Thank you so much and welcome. Thank you both. So in general, as we know, and we have seen even since promoting this event, that this is a topic that can generate some controversy. Maybe there's some taboo around it. And our whole goal with this grant and with this whole project is to maybe break some of that down, to talk about what it really means, right? There's words that sometimes scare folks off. And so we're here to kind of see what we can do about making this a more accessible topic for folks, right? And I just want to mention that it's going to be like a conversation. This isn't going to be, like a formal speech, kind of thing, or questions and answers are going to be for anyone that wants to jump in if anyone wants to. But I will direct my questions to Tatiana and Alejandra first, and then anyone that wants to chime in can do that. And we'll also be keeping an eye on the comments from social media. So that's a little bit about how it'll work. So this is a topic that generates controversy, right? So let's kind of talk about that. I want to start by, I'll switch the order. I started with Alejandra last time. I'll start with Tatiana this time. Tell us why the issue of reproductive justice for Latinas is important to you personally, but also why it should be important to all of us, right? Like why it's something that we should talk about more instead of maybe shying away from. Tatiana, if you want to address that first.
Yeah, thanks. It's a really important issue to discuss. I think in order to remove stigma, we have to have conversations with each other and with our community. For me, healthcare in general and breaking down barriers to care has been a priority for me. And I've been organizing around healthcare for about 10 years. But this is personal for me and for many Latinos. My family has been directly impacted by lack of reproductive health access, and this is a huge reproductive justice issue. Latinos already face so many barriers that include misinformation, religious indoctrination, and poverty. My grandmother had 15 pregnancies and died at the very young age of 62. Her last pregnancy resulted in a coma, and really caused a lot of health issues for her. which impacted my mother and her siblings. At one point, she went and asked her priest if she could go on birth control. And he told her that if she did, she would be excommunicated from the church. So that was why my grandmother, just had so many pregnancies. And this impacted the quality of life of my mom, her siblings, and generations to come. Had my grandmother had the resources that we offer today and been properly educated on birth control, family planning, her family would have really benefited from this. And we're still seeing this, right, in our communities. This isn't something that happened, 30, 40, 60 years ago. It's still happening now. So this is very personal for me. I don't want people that are pregnant to have to sacrifice their quality of life like my grandmother did. Everybody has the right to decide when and if they start a family, and to raise their family in a healthy, safe environment. These are the tenets of reproductive justice. And, I understand how impactful these programs can be. So they're very important to me.
Thank you so much, first of all, for sharing that amazing story, and also for making that connection to healthcare. A lot of times this topic, folks go right to the word abortion, which is important to definitely talk about for sure. But there is that side of actual healthcare, right? And contraceptive care, and that it's a broad thing. We tend to always just go and focus on that one issue, but it's so important to hear these stories. So thank you so much for sharing that. Alejandra, I'll repeat the question just because I know we all have so much to say about all of these important things. So tell us about the issue of reproductive justice for Latinas, why it's important to you, and also why it should be important for all of us as a whole.
Sure. I'll start by saying I'm Salvadorian American. I grew up in El Salvador, and that impacts a lot of how I see and what drives me to work on this issue. El Salvador, as you might know, is one of the most restrictive countries in the world in terms of reproductive rights and abortion access. So when growing up there, I was able to see up front what this means, right? What are the consequences of this? Who is affected by these restrictions? And I think at the core of this movement is realizing that across country lines, it's the same people who are most impacted by barriers to any form of reproductive health care, including abortion. And that is why the reproductive justice framing that was created and led by Black women and other birthing people here in the US is so important, because it highlights the intersectionality of it, the fact that how our identities and the different forms of oppression, because the color of our skin, because of our ethnicity, because of our economic status, because of our immigration status, what does that mean? And how rights don't look the same for all people across the board. And that's why this issue is so important. I think if you care about immigrant rights, if you care about economic rights, if you care about the environment, if you care about police reform, all of it connects to reproductive rights and reproductive justice, because everything around us influences how we live our lives. Do we have the resources to live them? Are we able to make the best decisions for ourselves and our families? And I think that's at the core of why we should care about it, because it connects, most likely, if you name an issue, it's going to connect back to reproductive justice. And I think that's what drives me. And also, when talking about reproductive justice, I do want to name specifically abortion, because it's the issue that's most talked about right now, and the issue that, quite frankly, carries the most stigma. And when talking about abortion, I would be remiss to leave out the fact of how the attacks on abortion are deeply rooted in systemic racism and white supremacy and control and classism and colorism. All of the isms that we're fighting against are deeply connected to the anti-abortion movement and how they operate. So if we want to create a vision for a future that supports our communities, that allows us to have the resources to not just survive, but thrive, we should care about reproductive justice, right? And ensuring that everyone is able to make those decisions, and that a few politicians aren't imposing their beliefs and their views on our communities, right? In the way that they're doing in so many other ways, right? So I'll leave it at that, but I deeply care about this issue because we've seen what happens when restrictions are in place. We know what happens when these harmful policies impact our communities.
Absolutely. Wow. Thank you so much. You said the word intersectionality, and that's my favorite word. That's one of my areas of expertise because it's so important, right? To look at that intersectionality of how this is all really rooted in white supremacy, all those brilliant things you said. Thank you so much for bringing that up. And especially as it pertains to the class piece, right? Which you mentioned, accessibility and who actually has access to this healthcare. And why framing it as a healthcare issue is so important because it is about that access, right? And who in society does have access. There's all those intersectional levels of that complexity and the nuance. Thank you so much for that. I wonder if we can go into a little bit, and maybe again, I'll switch the order again and start with Alejandra this time. So we've mentioned the taboo, we've mentioned the controversy, and we're going to go back to some of those topics if we have time that were mentioned earlier, because I do want to delve deeper. But I want to, especially for those folks in the audience that may be shy to bring this up with their own families, within their own communities, what are some ways that you think we can combat some of either the misinformation that was mentioned so brilliantly earlier too, or the controversy or the taboo around the topic of reproductive justice and specifically abortion, right? Like, what ways have you found have been maybe successful to try to bridge that gap and have that conversation?
Sure. So I've had more than my fair share of these conversations, at times difficult, of course, but so necessary. And I think what I've come to find is that values connect us. Values will always connect us. And in having these conversations, plus one to what Tatiana said, there's so much misinformation. And in having these conversations, you realize that. And when doing this work, you understand, oh, wow, like you're working off of this information that it really isn't true, like how abortion is perceived or how misinformation is spread or how disinformation is spread. And quite frankly, it's by design that it's that way. If the anti-abortion movement wants us to be divided, right, and to not have these conversations and to not be able to share our lived experiences. And when it comes to values, at the end of the day, what I've found in having these conversations, what we tend to agree on is that we all want the best for our families and our communities. And if we go back to that, and that is the core of the conversation, I've encountered that really helps have these conversations, and talking about it across issues helps have these conversations, and storytelling helps in these conversations. There's a great organization that I'd invite you to look into. It's called We Testify, and it's about storytelling and sharing the lived experiences of people who have had abortions. And they share a phrase that it's everyone loves someone who had an abortion, and that couldn't ring more true. I bet you if you look even within your closest circle, right, probably someone that you love and that you know has had an abortion. And stories break stigma, stories break misconceptions and misinformation. And quite frankly, just having these conversations, it can be difficult. And I will just encourage folks to plant the seed. It's a process. It's not I'll have one conversation and I'm done. It could be a years long process of constantly having these conversations and bringing it up and just connecting back to our values and what we want to see for our communities and leading us towards the vision of reproductive justice.
Thank you so much. I agree 100%. I think conversations are crucial. We're gonna go to Tatiana, but I just want to let folks know or remind folks that if you have questions, you can go ahead and also put them in the comments and we'll get them and see them and maybe be able to incorporate some of them. Again, Tatiana, if you could just speak to some ways maybe that you have found are helpful to combat some of that controversy or some of that taboo specifically, well, around reproductive justice in general, but specifically around abortion, especially because it is so taboo.
Yeah, absolutely. So I think Alejandra made a great point when she brought up values. I think we find that if we have these conversations around abortion with our family members, with our friends, we realize that we have a lot of shared values, and that in those shared values, many people do support the tenets of reproductive rights and justice. So education is really the foundation of tolerance and understanding. So we need to ensure that folks in our community have the right information so they can make informed decisions, so we can, break down the barriers and the stigma that surrounds conversations around abortion. Abortion is healthcare. So it's so important to go out into the community. We have an education team that actually does this. They go to schools and they go to different organizations and they have these conversations and provide them with the tools and resources to make informed decisions. So we really have a responsibility, as people in this movement, to ensure that, we're having conversations with our partners, and having anti-stigma conversations, because we can't be afraid to say words like abortion. So I think, I'll wrap it up there, but definitely, understanding that we have more in common than we don't, and our values are really what's going to guide this.
That's brilliant. Thank you so much. Yes, abortion is healthcare. Even just saying those things that maybe for those of us that are in the field or in this type of work feel obvious to us sometimes, but just saying those things to folks, in our circles can be so helpful, even if it feels obvious. Education, I think, is the key, and I think that's the perfect segue for us to come in a little bit, the actual announcement part at the end. So I won't jump the gun, but thank you for mentioning the education piece, because that is what's the key to everything, right? Is just getting folks educated. And a lot of times on that note, besides the taboo, besides the controversy, there's also sometimes fear among Latinas ourselves when talking about these topics, not necessarily out of, the traditional, thing, but there's also fear because of the history of forced sterilization, right? And the experimentation that was done on Latinas and is actually still happening today at the border, things that we don't talk about enough, I think, in mainstream situations. And so getting the word out also helps in that regard, right? To help maybe break down some of that fear, like the storytelling, like you mentioned, helps us feel less alone, right? Not just in terms of fear of our families or whatever the tradition is, but what is actually going to happen, right? In terms of this history of forced, experimentation. So I don't know if you want to speak a little bit to that. Maybe we can start with Tatiana this time.
Yes, I think, and it goes back to the education piece, right? So I think we need to make sure that we're having these conversations with folks in our community. But I think it's also important to understand the concerns that, BIPOC folks have, Latinos, brown and Black folks have awareness with the medical establishment. And I think it's fair to validate those feelings from the community. But again, the education piece is extremely important. It's also important to have networks that will work with our community, trusted networks where we can connect folks to resources. Planned Parenthood health centers, for example, offer a range of reproductive health services. We are able to we're able to see patients regardless of their ability to pay. And I think it's really important to connect people in the community with these resources, so we can be a safety net provider. Everyone deserves health care, no matter their identity, their income, their insurance. And we need to be really careful with how we approach our community, and also, entering these conversations without judgment, ensuring that we're creating safe spaces, and also that as healthcare organizations or civil rights organizations, we're connecting with other organizations that are doing and leading this work, to ensure that everyone is receiving the proper healthcare they believe in a safe space and setting.
Yes, thank you so much. Thank you so much. And Alejandra, if you have anything to add around this fear around this history, which is still, as we're being reminded of, thank you by the audience, it's still happening today, not only at the border, but to Indigenous folks and to incarcerated folks. So anything to add on that note?
I think I'll just emphasize on the point of how this is deeply connected to control and control of certain communities, right? And I think I'll point out that it's not by coincidence, it's by design that the places where we see the worst rates of maternal mortality, the places that have the worst anti-immigrant laws, the places that are trying to restrict access to voting are the same places that have anti-abortion laws and where these things are happening, right? So I think it goes back to the systems that are in place and the systems that together we need to chip away and dismantle to ensure that all communities, because when we talk about the forced sterilization that continue to happen right now, it's about control and about this idea of only certain populations will have access to reproductive freedom, others won't, right? And like, who has the power to decide that? And I think it's important to go back to the vision of reproductive justice, which is the idea of being able to have children, not have children, and just be able to make those decisions with the necessary resources and information to do so.
Thank you so much. Thank you so much. I agree. And I think that's also the perfect segue to bring in a resource that Sarai can tell us about a little bit that they've been working on. So Sarai, if you wanna let us know about your survey.
Thank you. Yes, one of our bigger projects of this year has been in collaboration with the Abortion Justice Committee of New Jersey, also known as El Comité de Justicia del Aborto de Nueva Jersey, to conduct an unbiased public health survey. And it's basically to gather information on like the attitudes that people have on the subject, other sources of information, where they're getting their information from, and areas of need regarding reproductive services within like immigrant and Latinx communities across the state of New Jersey. And it's not just limited to the topic of abortion, but about general reproductive health services like cancer screenings and gynecological visits and STD screenings. So we would really love it if people would take the time to take the survey. Our goal is 1,000 responses, and because of the hard work of the AJCNJ, we have reached 635 people so far, but we would love to hit that 1,000 before the end of September, hopefully. So we can plug that in, or you can check us out on our social medias, which will be plugged in later. But thank you.
Thank you so much. That committee is doing amazing work. And just so folks know, the survey is done bilingually. So the access piece is important for folks that may not speak English. It's done in Spanish as well. And so they're doing really amazing work. And so with all of this, I think all of this brings us to the perfect cherry on top of this discussion, which obviously isn't over. It's going to continue because we need lots and lots more of these discussions. And so Lauren's going to tell us a little bit about some stuff that's upcoming that may be of interest to folks. Thank you so much to our speakers and our panel. And I could honestly do this for 3 more hours. So y'all have been wonderful. And thank you so much.
Thank you. Yes, we want to remind everyone that this program, Train the Trainer, will have in-person workshops. And our first workshop is going to be September 16th in Freeholder. And this is going to serve as a vehicle to train Latinas to become reproductive healthcare justice ambassadors that will act as advocates for reproductive rights. So we just want to make sure that everybody has that information, make sure that you register. And we will also be visiting other municipalities throughout the state. As you can see, we'll be in Princeton, New Brunswick, and Jersey City. But the first one will be in Freehold September 16th. And I also just wanted to thank everyone for joining us and to ensure that you are following us on Instagram and our other social media. Here you have the Latino Action Network Foundation information. And we also at the Latina Civic Foundation also have our social media, so please stay connected and make sure that you register for our first workshop and for our other workshops. Thank you so much. This has been a great discussion and a great panel.